Kia ora, good afternoon. I am Trina Cooper. I am the General Manager for PARA. Some housekeeping details. Just a reminder that the session is being recorded and it will be made available on the PARA website. Please note that your video image may be seen when we share the presentation on our website and social media, so just ensure that you have your camera turned off if you want to remain incognito. We ask that you remain muted, and if you wish to ask a question, please use the chat function you see at the bottom of your screen, and these will be addressed during or at the end of the presentation. Today's pop-up chat is with Bernadette Nolan from Hawke's Bay Pelvic Health. Bernadette is a highly trained and experienced pelvic health and women's physiotherapist, mother of 2 little girls, wife and female advocate. She's also a certified holistic pelvic care practitioner, only one of 2 pelvic health physiotherapists in New Zealand trained in the field of physical, emotional and energetic methods to support women's health at all stages of life. And we will open with a karakia, and I'll just share my screen just so we have that available. We can all do it together. Whakataka te hau ki te uru, whakataka te hau ki te tonga, kia mā kina kina ki uta, kia mā tara tara ki tai, e he aki ana te atakura, he tio, I huka, he hohanga, te he moriora. Says the winds from the west, says the winds from the south, let the breeze blow over the land, let the breeze blow over the ocean, let the red-tipped dawn come with a sharpened ear, with a touch of frost, and a promise of a glorious day. And Bernadette, I'll hand over to you now.
Wonderful, thanks Trina. Thank you for having me. I'm really stoked to be here and talking about an area of health that I'm really passionate about. And I really wanted to just go into a little bit more detail about how the pelvic health and the physical component of that actually relates to our mental and our physical and our emotional well-being as well. And I think sometimes there's, recognition that imbalances in the pelvis, can cause many physical conditions that we're familiar with, and particularly in relation to the bladder and to the bowel. What we may not be too familiar with is that these physical conditions can also manifest in the abdominal area. It can affect our breathing system, our hormonal system. And I think what hasn't been given a lot of highlight is really that connection between how imbalances in the pelvic area can also manifest as many psychological conditions such as anxiety disorders, panic attacks, depression, and eating disorders. So that's what I'm going to delve into today, is how these are all interlinked and connected, how I work as a physiotherapist in my role helping women, particularly in relation to birth trauma. And my background for this is, yes, I'm a physiotherapist, trained and have been working for over 20 years. My area of work in pelvic health and women's health has actually stemmed back to my student days. And so I've worked in this area for a long time. And I think through that journey, I started to see that just treating the physical component for some women just wasn't giving the results. It wasn't starting to help some of these leakage conditions, or I wasn't finding that the back pain was going away, and some of these aspects that started to direct my learning in a different direction. And what I mean by this is that I started to delve a lot into how trauma affects our body, and how if we're not treating this at a cell level, as well as looking at it from a mental side of things as well, that this trauma can stay in the body, and this will manifest as conditions that, again, we associate with maybe muscle weakness in the pelvic area. I also then went on to train and to do a lot of trauma-informed courses and postgrad training in this area. I also started to work and to look and delve deeper into the energetics and the connection of really looking at that fascial tissue and component and how it all interlinks together. So I've got a few bows or a few strings to my bow, I should say, in terms of how I do it. It's certainly not a journey that I work on my own. I have got many fantastic links with counsellors, osteopaths, chiropractors, and fellow physiotherapists that we provide a really beautiful and comprehensive model of care to many women. So I'll just delve into, where this, passion stems from and why I love speaking about it. And pelvic health is really so important. And I think as many of us here have been women in that, we can identify that there are huge numbers of women that have problems. And there's a massive lack of understanding and education around, how do we deal with these symptoms? And the reality is, I think for many women, is that problems down here in our pelvic area, they are really hard to talk about. They are a huge association of shame and embarrassment around these conditions as well. What I see day in and day out in my clinic is the effect that these conditions in the pelvic area have a massive limitation on a person's ability to function and their quality of life. And this has a significant and a real direct on a woman's mental health and well-being and how she's showing up day to day in life as well. The sad reality is, I think our society has normalized pelvic health conditions. And what I find is that a lot of women don't even realize that some of the conditions that they have in their pelvic area are in fact what I would term as even injuries or conditions. We only have to look at maybe the Continence New Zealand website to see there are statistics in New Zealand. We know 1 in 3 women will experience some form of bladder leakage. Particularly, this is higher rates after we've had vaginal deliveries or cesarean deliveries. 80% of women will have some form of pain associated in their pelvic area, be that from as a pain with sexual intercourse, back pain, or hip pain associated with birth as well. We look at 1 in 8 will have some form of bowel incontinence or issues with constipation. So our stats are huge. They're quite big. And yet for an area that has a lot of conditions and women presenting with this, we don't actually have the resources in a lot of our regions and DHBs within New Zealand to cope with the amount of women that need help as well. And we'll talk about that a little bit later on. Now, I think when you associate a pelvic health or a women's health physiotherapy a therapist, there's still that preconceived idea that we are just standing at the end of the bed, looking at someone's pelvic floor and shouting at them and telling them to squeeze and tighten as hard as they can. And it's that message that I really want to move away from a little bit today, is that the whole idea of squeezing and tightening our pelvic floor, we really start to need to move away from that dialogue and move away from that way of educating women of that being the only thing that needs to happen as a form of recovery post-birth. So I'll explain, and I'll use my pelvis in a few minutes to elaborate on that a little bit more. And I just thought there was an interesting study that may be of interest for you as well, is that when we look at the research around the ability to do a pelvic floor contraction, many studies have shown that only 30% of women know how to do a pelvic floor contraction correctly. So even amongst us here on this, that means there's 70% of us doing God knows what when we ask them to do a pelvic floor tighten or squeeze or lift. And this is very much reflected in the clinic, setting where when I ask women to show me, and so that I can feel what they're able to do and what movement is there. But more importantly, it's that awareness. So many of us have no idea actually what we're doing with our pelvic floor, or what it should be doing day to day as well. And it really is a muscle that is far too important to ignore, considering that it is part of our continence, ability. It's part of our sexual function, and it really is what gives stability to our spine and to our pelvis. So it really is something that we've got to consider. So what I thought would be useful is just using my pelvic model here, is that while we're talking about this in relation to pregnancy and birth, I'll just move my camera down a little bit. So you'll all be familiar with the pelvic bones here, is that one of the things that we need to ascertain when I'm talking sometimes to women in an antenatal setting is to get them to understand that their bodies are changing. Now, I'm not going to go into that in huge details here. All of us will be familiar that, the abdominal muscles are obviously going to stretch out to cope with that growing baby. Our pelvic floor can descend anything from 2 to 3 centimeters just from pregnancy, the carrying and the weight of the baby. But we've also got to just delve a little bit higher and look at the impact on our breathing muscle, our diaphragm. And that can move anything from 4 or 5 centimeters up into the chest area to accommodate that baby growing as well. And as you know, all babies lie and position themselves in different manners of ways in the abdominal area. So we'll start to see greater stretch or movement for some women in other areas. Now, why is this all important? Is that we've got to look at then, in terms of how that baby is delivered. So be it via vaginal delivery or a C-section, and how that has impacted that woman in that moment. So without again going into too much kind of really basic side of things with it, again, is that what I like to give women an understanding is that these pelvic bones don't stay static during pregnancy or during birth. So when we look at those latter few weeks of pregnancy over that last month, when we're starting to see the pelvis move into an open birthing position, we're starting to see a widening of these pelvic bones here at the bottom. And during birth itself, as baby is coming down through the birth canal, we need to have that movement through the sacrum and the coccyx here, which will often see a deviation from one side or the other. We'll see a greater widening of these pelvic bones. Now, why that's important, just to mention that as a basic side of things, is that will impact the position that the muscles are lying in and what has happened to all the connective tissues around there. So depending on how baby was delivered, so if we have had a woman who has delivered with no interruption to her birth process, and by that I mean no interventions, and that she has managed to birth the baby with just that support of people there, she has felt safe and in control of that situation, what we'll find is that these bones will automatically start to reclose. We'll start to see a beautiful repositioning of the pelvic organs and the abdominal organs in those cavities. We'll start to see a lovely descent of that breathing muscle, the rib cage starting to come in, and the pelvis starting to close again. And this happens over that first month or 6 to 8 weeks after baby is born. And a lot of these women will then be able to reconnect to these muscles and will start to feel that they're able to physically get out and about and to start to move. However, when there is interruption to the birth process, this is where someone like myself comes in to be able to assist these women in how to recover. So I explain it to women in the sense that there are the medical realities that some women obviously will face during birth. Some women will require perhaps an episiotomy, some women will tear, some women may need assisted deliveries with the ventouse, the forceps, whatever that may be, or some women will go on to have surgery. Now, what can happen for some of these women in that situation is if they are starting to feel out of control, or for some reason they don't feel safe in that situation, is that fight or flight system in the female body will start to kick in. And that fight and flight response is very much associated to, if we talk about it in chakras, we can talk about it in many different ways, but is all related to this sacral and this coccyx area of the body. So this part of our body, our pelvic floor, our pelvis, is still very primal in its function. And a lot of women will understand this when I explain it to them in the basic sense of, when we think about the tailbone area, and I always say to women, and I show them a diagram, which I will show you in a sec, of our tailbone muscles, that they act the same as any other mammal that's walking around out there. So if we think of a horse or a dog, when it's hurt and injured, in pain, sad, what do they do with that tail? They will tuck it in between their legs. And we do that as women as well. So in some instances where these women may be through the birthing second stage, or maybe even prior to that in those early first stages, if they have any sense that maybe, they're watching on a monitor that baby's heart rate is starting to drop, they're fearing for their own life, maybe being wheeled into theatre, is that we'll start to see that fight or flight response starting to kick in. But it's a situation where we can't run from and we can't fight. So the body's only other defense mechanism is to freeze. And this is what I find quite commonly after birth, is that the pelvis and the muscles and the connective tissues and the bones around there have all just frozen in position. And there are many women, even many, many years after they've delivered their babies, and when I will say to them and explain it in a way that your pelvis is still birthing your baby. And this is very relevant for particularly the women who've had an emergency C-section, where perhaps they were quite far on in that pushing, or even that had even got to the second stage of labor, where the pelvis is open and ready for that baby to come out and the baby hasn't come out, is that often these women will experience maybe a lot of back pain, a lot of abdominal, a lot of pressure, and they'll often go on to have some bladder and bowel issues, or maybe even experience painful sex, and they can't understand why they're having any of these issues if they haven't had a vaginal delivery. So the impact of sutures or tearing, be that at a C-section area or down in the perineum for any woman who's maybe had an episiotomy or any level of perineal tearing, will also need some special attention to help them to maybe start to learn how to move these muscles again. So for a lot of women in this instance, what we need to teach them to do first off is to actually let the pelvic floor muscles release and go before we can start to re-strengthen them. But because they might be experiencing some pelvic floor leakage or maybe some constipation or some prolapse symptoms, we're often telling them the opposite message. We're telling them to squeeze and to tighten and to do their pelvic floor exercises repetitively throughout the day. So I always kind of say that one of the things when it comes to any muscle function, whether it's in my shoulder, my arm, or in my pelvic area, is that we can't strengthen a muscle that doesn't know how to move. So let me just show you a little diagram of the pelvic floor. And I like to use this little paper model. I don't know if any of you are familiar or have seen it, but I'm not sure if you're going to be able to see the actual names of the muscles which are on here, but I'm going to explain it just in a very simple way. Okay. So the view that I've got going here is, imagine I'm lying on my back and you guys are looking in between my legs right now. So here's my tailbone at the bottom and here's my pubic bone at the top. And what we're looking at is this ring of muscle around the back passage opening, which is our external anal sphincter. We're looking at this ring of muscle around the vagina and the bladder opening. And then we have this band of muscle that comes from the sitting bones, these two bones here, either side across, which comes across, which gives that sense of stability and movement through here. And of course, this is often where we'll have experience of episiotomies or teariness down through that area. So that can disturb, that positioning of where the pelvic bones are sitting for someone. Now, these outside layer of muscles, these are our squeezing muscles. These are the ones, if I want to stop a bit of wind or I want to stop a bit of wee coming out, that I'm going to give a squeeze to. And most women can connect to these muscles quite well. And even if I asked you all there right now, can you squeeze your pelvic floor? You'll be able to maybe feel some tightening around your back passage or your vaginal area. Now, I want you to think of these muscles like sprinters. They come in strong and fast, and then they fatigue really quickly. So they're often not the muscles that I want to start to work on initially. It's more this inside group of muscles. Now, again, there's a lot of names and perhaps not the clearest view through there. So let's just work on the colors here. Now, again, if you can imagine you're looking down inside my body, if I orientate you, here's my tailbone and here's my pubic bone here, and the white area is obviously the rim of the pelvic bones through here. So if we come from the tailbone, and you can see that there's an orange kind of loop of muscle around the three openings, and I'm going to show it to you with my fingers here. And sorry, I am going to stick my fingers up at you for a second. Think of it like a little loop, a little V shape of muscle just around those three openings. And how it moves is that it closes and lifts. So it's a lifting action, okay? So those muscles are attached into that pubic bone at the front, they close and they lift. And the red triangle shape of muscle that's here on the side is coming down the walls of the pelvis, creating that whole basin of muscle, which is what we know as that levator ani group of muscles. Now I'm going to show you with my hands. I'm just going to stand up for a sec so you can see my hands cupped through here. And I've got that V shape of opening of the muscles here. Now, what I want you to visualize this muscle working like is, if you walked across a trampoline and there's a little bit of a give under your foot, that's what should be happening in that deep layer of your pelvic floor muscle. Now, if I start to jump on that trampoline, I'm going to have some more movement. And that would associate if I started to walk fast, if I suddenly tripped off a curb, or I started to jump or move, is that my pelvic floor should be able to move in response to that as well. And this is where we start to run into issues, because there's a lot of women out there that are walking around on trampolines that are too tight and too firm, so that there's not a lot of movement happening in that pelvic floor. And similarly, we can also have the opposite, where there's a lot of pelvic floor muscles that are very weak and are not moving very well. So we have quite a lot of lack of support through that area. Now, both of these, be it too tight or too loose, can be very unnerving for women in the pelvic region, because it can give that sense of that we've lost that sense of control or ability through there. And this is something that I will find a lot with women who have pelvic floor issues will also have quite high levels of anxiety. They might be afraid to go out for fear that they may not be able to find a toilet. They may not be feeling very comfortable with every step that they're taking, particularly if the organs are descending or prolapsing down through the pelvic area. And there's that fear that they might leak and not know that it's going to happen if they're out in public as well. But in terms of just starting to associate that side of things where these muscles are starting to help or are designed to help and support the organs, can you visualize now that if I have that lift and that nice freedom of movement in my pelvic floor muscles, that's going to be able to help to support my pelvic bones. It's going to be able to help to support my organs. Now, what's really important to understand is that that pelvic floor, that little trampoline movement through there, its best friend is our breathing muscle. And these two muscles should work in conjunction together. So often when people do come in with levels of, say, anxiety or have had panic attacks, we'll often go through ways of helping them to breathe and to start to get their diaphragm to relax and to start to move efficiently. But if we've got a pelvic floor that's not responding to that, the diaphragm will also be out of sync. So the key thing for me in my working day is to make sure that we've got that association of movement and that women can connect that movement of their breathing muscles and their pelvic floor together, because that's how we're designed to move. So in terms of if I do a cough, my pelvic floor should have the ability to be able to rise up and to support me against that pressure. If I lift my baby up out of the cot, or I'm putting them down, or I'm closing the car door, my pelvic floor should be able to respond to that pressure and that movement to be able to support and to give me that control and that stability through my pelvic area. So this is where I'm just going to go back to our pelvic model here. And I've talked about, the levator group of muscles around through here. And if you can see this, it's a green little muscle coming off the tailbone. This is the coccygeus muscle that I just mentioned and talked about in terms of what we wag our tail with. Now, our pelvis, when we walk around, is not flat in this orientation here. When we walk around, our pelvis is more in this direction here. Okay, so think of it more like your pubic bone is facing down towards the ground when we sit or when we stand. So those pelvic floor muscles are in this orientation through here, okay? So when we've got a tailbone muscle that's tucked in and it's tight and it's doing what it thinks it should be doing, is to protect us, and perhaps it's also associating that our bodies is still not feeling safe, is that we start to limit our ability to be able to move, not just through our pelvic area, but also through our spine and our abdominal area. So one of the biggest things why we can't connect to these muscles and why maybe our breathing is still out of sync is that just through the process of birth, as I was talking about earlier there, that if a woman does experience some intervention, and this can even be also associated with induction, not necessarily just through assisted deliveries or with tearing or any perineal trauma, is that the organs also need to shift and move. And if our pelvic organs are not sitting nice and centrally in our pelvic bowl, that can also cause that inability to be able to connect to these muscles. So sometimes we have to just, before we even start to get women to think about our pelvic floor muscles, we need to start to go, where are the bones sitting? Have they reclosed after birth? Is the woman able to walk around comfortably? Where are the organs sitting? Not just the pelvic organs, but also the abdominal organs that shift and move naturally through a pregnancy. Have they descended down into their resting position? And more importantly, are they moving? It's not uncommon at all for us. It's very widely known. We know there's that brain-gut connection and that association with, women talk about it a lot. We talk about it a lot in clinic, and those quick feelings and all of that side of things that we feel through there. Because a lot of that comes back to, the mobility through the organs as well. And again, that's where that synchronized movement between our breathing muscle and our pelvic floor is so important for all our abdominal and our pelvic viscera. So if our organs are happy and moving, then our muscles will move, and vice versa. So I always explain to women that think of your breathing muscle and your pelvic floor like two muscles that are massaging the organs up and down together, so that we're getting that nice association of movement through that area. So this is where a lot of my work will be based around initially going, are the organs moving? How is the body recovering? Do some of these women have quite a large tummy diastasis? that we would see through the abdominal or muscles through here as well. And this is important in terms of thinking about that we can't just look at the pelvic floor post-birth. We need to look at what's happening through the abdominal muscles. And we also need to look at what's happening through the back muscles as well. So it really is looking at the woman as a whole rather than just trying to pick out one part of her body and to hope that that's going to help with all her recovery with it. So a lot of the women in terms that either get referred to me or that I will see, many of these women have had some form of perinatal counseling. Some maybe have had psychological input, particularly depending on how their birth was. But there's also a lot of women that will self-refer or have been referred by their midwives who may not have had any counseling or psychological input. And not all women do need what I will talk is the talk therapy. Because one of the ways that I explain it to some women is that it's not that we are through the physical impact. It's not that we're trying to forget what's happened in their experience of their birth. It's more to give the tissues at a cell level a new way of interpreting that. And this is to give that sense of safety back to the body again. And this is where looking at energetic or emotional impact for women is looking at how do we help that body to feel safe again? How do we help that woman to allow her tailbone to move so that she's able to bend forward comfortably and put her baby into the cot, or she's able to, hold a toddler while they're kind of wrestling, trying to get into the car seat. All of these scenarios where a lot of women will find that they haven't got that mobility and movement and how pain will start to manifest through their body. So in terms of with that, one of the areas and the tissues that I haven't talked about just yet, we've talked about the bones and the muscles, is also the impact of the fascial tissue. Now, fascia is one of these structures in the body that's been getting a little bit more attention in more recent years. And it's the layer of tissue, really simply, that connects everything from head to toe in our body. And it wraps around our muscles, it wraps around our organs. I describe it to women as almost like a 3D spider web throughout our body. And in a more simpler form, the way I explain it to women is I get them to visualize it being like Glad wrap, Glad wrap that we're putting over a bowl of food, and the way sometimes that will get a bit stuck and caught on itself. That's often what I will feel in the body. And a lot of that fascial tissue from the whole trunk and abdominal area, it comes down and it collects in our pelvic bowl. So some of that restriction that we will have through the spine or through the abdominal area is actually originating through the pelvic area. And as daunting as it might seem to say to somebody the best way that we're going to be able to release that is through the vaginal area, this is done in such a way that is very gentle and respectful to the body to be able to unravel sometimes just even that pattern of where the baby has come out. And it's, it wouldn't surprise any of you by explaining that a lot of women have that idea that the baby literally just comes straight out, and that they haven't ever been told sometimes that that baby has to twist and turn and whatever direction they're coming, whether that baby's coming posterior, whether they're coming down the right or the left-hand side of the pelvis, and how that can impact on how the tissues will be post-birth as well. Now, our fascial tissues is what houses our nerves and our blood vessels. So if that tissue is tight and restricted and not moving, that will also impact how our vascular system and our nervous system is able to function and move as well. So one of the things in the pelvic area where pain can manifest is to do with congestion, again, that things are not moving. And when we look at that heart as it's pumping the blood out around the body and it goes down into the legs, we know the calf muscle starts to help with that return of blood, that venous return of blood to the heart, but it's also the pelvic floor that plays a huge role in that as well. So even from that component, from a physical component through there, is that we need to have that pelvic floor starting to work to really help get that venous blood back to the heart. And that also has an impact on physiologically how we are able to cope with how our breathing system is working. And again, what I find for some women, when I can start to help get them to move through the pelvic area and their diaphragm, that their anxiety levels will start to drop quite significantly, even within a couple of hours or a day or so of having that treatment and movement. So everything in the body is connected, and we have to look at that woman just from the way she gets up out of the chair and walks into me in the clinic, to even just down to that impact of how we're assessing her pelvis post-birth as well. The simplest question of how I start to go beyond, because a lot of women will come for a physical side of things. They will come with a question, maybe they have leakage, maybe they have prolapse, that side of things. But how I start to ascertain the impact of how they are coping, I guess, mentally and emotionally, is that after they have told me their birth story, or maybe shared if they've had previous miscarriages, or they have older children, is that I simply ask them, is that how did you feel after that experience, or how did that experience make you feel? And often that's the time where they'll stop and may look at me for a moment. And almost in that second, I can see straight away the impact that birth has had on the woman. Many women will, their tears will well up in their eyes. Some women will use quite strong language where they say it was horrendous, they were traumatized after it, they would never do that again. Lots of kind of, big signals to me that perhaps they're not coping as well emotionally or mentally. And that this also will then impact my ability to be able to treat them physically, and how I would be able to treat their prolapse or incontinence. So in terms of this as well, there are definitely some of the women that I know when they've come to me that I know they need some more specialized impact or treatment from psychologists or birth counselors or perinatal counselors. And this is a really, really great time when I can talk to them and be able to explain the link between their birth and how they're feeling and how they're showing up day to day. I think it's also important to just say at this point as well, is that not every woman is traumatized after their birth experience. And I don't think we celebrate or talk about this enough either, is that many women do have very empowering and amazing births. And even just the physical changes that I've just talked about for some women, some of those women also just need some of that physical treatment just to help to realign, or just to release any restriction, and to help them just connect to these muscles in the pelvic area again. So the key thing really is looking at, when we delve into particular conditions in the body, is that the length that the woman has had these conditions as well will also be greatly impacting her mental health. I think it's very rare, and I think you would all agree with me, it's very rare that in the ideal world that women would be able to come and see any health professional at 5 or 6 weeks postnatally. Most PHP systems have significant wait lists. Even a lot of private practitioners also have wait lists where women are often in maybe a couple of months and even many, many years down the track before they will present to health providers. I would say most commonly where I would see women would be around the 10 month marker post-birth for some women who are self-referring. If they have been picked up a lot earlier, I am now thankfully seeing some women at that 6 to 8 weeks post-birth as well. And this plays a huge, huge role in their ability to be able to heal and recover. And I think using the word heal is really important, because heal really, if we look it up in the dictionary, it means about becoming well again. And that can't just be looking at one physical component. This is where we've got to look at how these all integrate together. So for any of you that are counselors or working as plunkett nurses, or in that scenario where you're seeing women perhaps a little bit further down the track, is that it's identifying that, some of these women who may be coming to you for their anxiety or their low mood disorders, is that they may perhaps also have some physical conditions that perhaps has never been asked, or nobody has ever gone there with them. Now, one of the biggest gifts that I always say as health people that we can give women is to let them know that there is help. And although they might have a grandmother, a mother, or an auntie or a sister who experiences some of these conditions, that's not necessarily what is normal, and that they don't have to live with this condition, and that there is help available. And seeking this out in whatever part of the country that you're in, Our women's health physiotherapists has really grown in numbers in recent years, which is fantastic to see. Many of our DHBs do, in the bigger centres, do have some very experienced and really well-educated physiotherapists in the DHB system that you can refer in through. And many locations now do have private practitioners that are also working, and maybe not as accessible to everybody, unfortunately. But definitely there's people around in most areas, and I'll send a link to Trina of where you can access and how to find some people that are local as well. I think, looking at, how do we broach some of these questions? Because again, even for ourselves, it can feel very confronting to talk about, issues that are associated with the bladder and the bowel and our sexual function. And I think it's again is maybe looking at, not just in terms of how they're coping day to day, mentally, because again, what I find a lot of women will say to me is that they may have gone to their GP for their postnatal checkup or their immunizations with baby. And, the doctor has asked them if they're doing okay. And they say yes, which most women would say, yes, we are doing okay. But behind that, yes, it's to maybe even just the simple questions. Do you feel that you have good bladder and bowel control? Are you emptying your bladder and bowel well? And if the answers are yes to this, then fantastic. Have they had intercourse since the birth? How has that felt? Has it been something that's enjoyable, or are you experiencing any pain with that? And again, you'll be able to pick up very quickly how willing that woman is to talk about those conditions. And I think sometimes it's just opening that door a little bit, and you'll find that women actually are very relieved to have somebody to talk about, and to be able to share that they are actually suffering, and that there are a lot of conditions that they're experiencing that maybe they don't understand what's happening to their body, and that they're just feeling that this is normal. Pain is one of the biggest things that I see that a lot of women will continue to suffer with many, many weeks and many months after birth. And sadly, one of the things that I pick up a lot postnatally for women is that sometimes these scars or these episiotomies or perineal tearing that actually have not healed properly, that sometimes there's sutures that have not closed over or have unraveled a little bit, but actually nobody has looked at these from the day that she's given birth, or that from that repair was done. I think infections can be picked up, and often are picked up very well for some women, but yeah, sometimes that where things are just not healing right, and how we go about and addressing that. But there's definitely times where I will contact my gynecology or obstetrician colleagues to ask them to bring these women back and to have a review as to whether or not they need to have these sutures relooked at, and maybe in some cases resutured at a later date as well. So I think, the connection of all of this, of why we need to care for our moms a little bit better, why we need to start to look at them holistically, is that, it really is the foundation. If mom is not coping well and not showing up and not being able to look after her children well, it has a massive impact on our children's ability to thrive and to function as well. One of the big government initiatives at the moment is looking at that well-being of the child in that first year. And sadly, as I trolled, through it, looking, there's really very, very little for the mom, in that whole big rollout of looking at the health of baby. So I think, there's a huge part of where we do need to talk about these conditions. We do need to talk about, the impact that pelvic imbalances, pelvic conditions are having on women mentally. And this can transpire through a woman's entire life. One of the other biggest groups of women that I see in my clinic is the postmenopausal women. And what I find is the biggest factor that a lot of these women will say is that, why has nobody explained this to me? Why has nobody told me any of this? And a lot of these women will be very angry and very upset, and that they have spent a lifetime of hiding some of their symptoms, not just from their wider community, but from even their own partners in some sense. And a lot of these women will share that they have felt broken, they have had a very lost sense of who they have been since they've had their children. And some of their children are well into their 30s or 40s at this stage. But it's never too late, because the difference, even for women in their 60s, 70s, and 80s, that I see is phenomenal, and how that changes, and how these women just come in just looking like a different person. You can see it in the way they walk, the way they hold themselves, that when they start to feel that they have control back over their bladder or their bowel, or that it doesn't feel like everything is falling out down below, how this will make such an impact to them mentally and how they show up day to day as well. So I think, my real, I guess, key take home message will be that, it is never too late. Even though we talk about postpartum, I always say that once we've had a baby, we're always postpartum. There is no full stop at 6 weeks postnatal. If we tend to minor problems in those early stages, then we can avoid a lot of these major ones later on. And really getting women to listen to their body and to listen to the messages that they're sending us. Often I take away, when I talk to a lot of more women in a public kind of setting and that side of things, the way we can take away the shame and the embarrassment, say with bladder leakage, is that if they're running down the road and they're experiencing leakage, what I say to them is that it's just another way that your body is trying to give you a signal that something is not right. Think of it like having that niggle in your knee. You're probably going to go and see somebody because it's hurting every time you run down the road. And that's all your bladder is asking it to do. It's saying, hey, something's not right. And that could be the simplest thing, where it's out of alignment. We might need to help it to be readjust. We might need to get those muscles or those bones supporting around it a little bit more, or releasing that fascial tissue. And again, the difference can be quite phenomenal to how quickly a change can occur. And I think, for us as any health practitioners is to start to recognize that, there is so much more to a woman than just her pelvic floor. And when she's gone through that phenomenal change of carrying a baby through pregnancy and going through birth, that we've really got to move away from just telling her, just do your pelvic floor exercises and that everything will be okay. Because I think that message is really what a lot of women struggle with, and feel that they're not being listened to and not being supported in their journey. One of the things that I just thought I would mention at the end is that a particular clinic that here in the Hawke's Bay, that myself and a GP with a particular interest in gynecology have been trialing for the last 10 months. And we've been looking at prolapse and incontinence from a holistic viewpoint, so that we are not just bringing these women in to look at the physical component of prolapse and incontinence, but we're looking at how that we can support their mental and emotional well-being as well. We've had a huge success. We've had a woman from Massey University, a researcher, a sociologist, who has interviewed all the women that we have treated in the clinic, and she is looking at it from a sociological point of view, of looking at the impact that these conditions have had on women, and how by having that treatment and care and encompassing, looking at them as a whole person, of how that has impacted not just them mentally but emotionally, and how it has affected them on a day-to-day basis as well. And we're really excited that this is going to be published over the next few months. And I think this is the way of our healthcare. This is what people are seeking, is that they don't just want to come and to look about one thing. People know now that things are connected, and that often I find that women are seeking that a little bit more than just being told to squeeze your pelvic floor and hope for the best. So I hope I've given you a little bit of an insight into some of the work that I do, and that why it's important that we look at this, and that when we are seeing women with anxiety or depression, that maybe just taking that step back and going, actually, what is going on down below? And is there some symptoms that may be contributing to how they're showing up in your office, or how they're presenting when they come into your clinic? And starting to maybe seek out who is available in your community to help and support. It's not just physios. There are many wonderful chiropractors and osteos that also do really good work to help women recover physically post-birth as well. And it's just finding out, who is there to help support you in your work, in your role. And I think any of us as health practitioners, we can't fly solo. We can't do it all ourselves. And it's having that, really good support from other practitioners as well to get the best and the most benefit for women as well. Does anyone have any questions at all that they would like to ask? I thought I would leave some time for that. Yes, Janet, is it?
Yeah,
Hi.
thank you for that. It's really interesting. I tell women to imagine that they're lifting up a marble with their urethra.
Perfect.
Yeah. Which I've heard, I can't remember where I heard that. But I have another question. I've just been to see someone 3 weeks past a planned cesarean. She's a GP. She wants to know when she can start running again. And I said, not yet.
Yeah, which was a good answer, definitely.
Yeah.
But I think for someone like that, we need to give her a reason of why not yet, because I think that's the side of things. Particularly, I mean, there's so many women out there that do want to get up and get running and going again. So it's the impact of healing, and I think as probably she's a GP herself, she probably will understand, that the tissues need to heal. I was going to say, think of a cut on your finger. It's not going to heal if we continue to pull and open at it. We've got to allow those sutures to heal, giving her that explanation that it's not just what we see on the outside. There's a whole layer of suturing and stitches that go on. But the most important thing for somebody post C-section from that side of things is that actually, can she connect to that pelvic floor? Is she able to? So beautiful description there, picking up the marble. I often say, let's get you picking up a blueberry with your vagina and that side of things. And even if we all did it here now and we thought, can we draw or pick up through there? Now, it's the effort that you would see somebody doing that with, because if she's squeezed in her belly and she's pulling everything up, we're not actually connecting to that muscle that she needs to have that trampoline movement when she's running down the road, because it's our muscles that should be the shock absorber. So for someone like that, when the body is still healing, her pelvic floor probably is in a holding pattern just to protect and keep everything nice and rigid and stable at the moment. So if she starts to run down the road, what often can happen is that it will most likely be the organs that start to take that impact. And when I mentioned earlier that often where I start to see women who will come through at 9-10 months postpartum, are often the women that will say to me, I was fine post-birth. I had no issues. I felt fine, but I've started going back to the gym, or I've started to run, or now my little baby is moving a lot quicker, and now I'm starting to leak, or now I'm feeling that things are not right. So one of the simplest ways to say to her is, maybe I would say, do you want to be able to run right now, or do you want to be able to run for the rest of your life? Because she's potentially setting herself up for injuries through the hips and the backs as well. There's a really wonderful resource, and maybe I'll send this link to you, Trina, so you can share it with everyone. In the UK, about 3 years ago, there was a return to running postpartum guidelines that came out, and some really simple graphics for some people. You can give the whole big document, and I might send the whole big document to you guys. And then there's aspects you can take away. And there's a wonderful Facebook and Instagram, community around that, where, for someone like that, I would be saying, here, have a read of this and have a look at this and go with that. So yeah, I hope that's the answer. Perfect. Anybody else have got any questions or anything at all?
Great. I think you've done a very thorough job, Bernadette. Really, really informative presentation. Gosh, learned so much.
Oh, great. Thank you, Trina. That's good to hear.
Great. I don't know about the rest of you, but I've been sitting trying to pick up my blueberry as you've been talking.
Yeah, and what I should say on that, if it doesn't move and you feel that you can't feel that muscle come up and come down and let go, then that's kind of the point where you go, okay, is there something restricted or not moving? Sometimes you just got to sit with that for a little while and to see if you can find it. So that's always the things that I say to a lot of the local midwives here, is that if they've explained that, and the woman is like, yes, I can feel this and I've got good control and support, or if they're sitting there going, I have no idea what you're talking about, then they're often the women that just need, and they might need just even 1 or 2 sessions just with somebody like myself, just to, to help them to have that awareness and to feel what's happening down there.
It'll be amazing, wouldn't it? You go to your GP for your baby's 6-week checkup, that the parent gets the 6-week warrant of fitness as well, and picking up something like pelvic floor health would just be so important, and having birth trauma recognised by ACC as well would certainly help with some of those long-term issues as well.
Yeah, unfortunately, that's an issue that is very much in debate at the moment. And also, I think what's really good is that pelvic health is being recognized. It is getting more recognition. I'm certainly being contacted by a lot more GPs than I have ever been before with questions and that side of things. Just locally, even here, our group of gynecologists and obstetricians have become much more aware and are a lot more proactive with who they're referring and why they're referring as well, which is great. Absolutely.
Fantastic. You're doing a lot of amazing work in your region, and hopefully that's being replicated across New Zealand as well.
Thank you. Yeah.
Can I just ask,
Yes.
there was a petition presented to Parliament around pelvic floor health and the funding of it. What came of that? Do you know?
So the day that it was meant to be presented down in Wellington, it was unfortunately around one of the lockdown times where the levels changed. So it had to be postponed. And then it was being represented. So what they needed to do was to get one MP to take it on board and to write a letter. And I don't know if you've seen just very recently, one of the Green MPs has just taken that on board. And that now that letter is being presented. So now there's a process of different committees that it needs to go to get to actually for a discussion and a debate into Parliament. It's likely it will, I think realistically, it'll take a few years before we see anything at the ground level of change. And this is where particularly a group of us here in Hawke's Bay is that we've kind of looked at what can we do locally at the moment to help create some change. How can we interlink some resources that we've got through the DHB to help with that? But yes, it's definitely, the wheels are in motion now, and it'll be fantastic to see what comes of that. And there's a lot of very wonderful people involved in pushing that through. So I think some change will come, but I don't think we'll see it happening this year or next year just yet anyway. Yeah. Yes, Jenny said, yeah, it was on the news last week. You're right. Yeah, absolutely. Any other questions at all?
Right, looks like you've covered everything well, Bernadette. If you can send those links through to me this afternoon and we can get those emailed out along with the recording. And
sure,
just a huge thank you for your time today. I think we've all certainly learnt something. Just don't look just at that pelvic floor, just look that there is more to what is happening with the mums bits down below. There's lots of little muscles in there that we didn't all know about.
Yeah, great. Thank you. It's a pleasure being here.
Lovely. Thanks, Bernadette. Thanks, everyone.
Thank you.